All right, so we were just doing this in the break, LaShonda and I, talking about my brother, because he's a nurse practitioner. She's a nurse practitioner. But he's not here, so enough about him. Thank you for coming in on what is just a cruddy morning. And it's a topic that needs some attention. We're talking about blood pressure this morning. And one of the things that I was talking to you about, so I feel like every time I go to the doctor and they do the numbers and they'll say, I'm not going to say a number because I'll get it wrong, and I'll say, is that good? Because I don't know the context of the range. So can we start there with what is good blood pressure? What are the numbers?
Okay, so let's first talk about what high blood pressure is.
Sure.
So our blood moves through our body from our heart and it feeds our vital organs, but sometimes that pressure is just a little bit too high. If that top number, which is a systolic number, you know, we really want it to be about 125 or lower. The bottom number, the diastolic number, we really want that to be like 80 or less. But when you have other conditions such as diabetes, you know, or other medical problems, your provider may want to manage you a little, you know, tight. So everyone has their individual stories. But what we do know is that 1 out of 3 Americans actually suffer from high blood pressure. And in addition to managing your blood pressure with your medical provider, there are things that you can do as an individual to prevent and to control your blood pressure.
I'm going to go out on a limb and say 2 of them are diet and exercise.
Diet and exercise, good thing. When you talk about diet, we encourage people to eat more fresh fruits and vegetables, stay away from the canned foods, the processed foods, such as packaged goods. So if you can do fresh, frozen, and prepare your own meats, reduce fast food. You don't really have control over what other people put in your food, and food that are, you know, too sweet, concentrated. But one thing we do not discuss is stress. Stress also can contribute to high blood pressure. So some stress we can't avoid. But if you can do things like access resources, family members, yoga, meditation, prayer, to sort of counteract the outcomes of stress, that also is something that we need to talk about.
When your pressure is high, what are the immediate effects on the body? I mean, is it something that if you're at home and your blood pressure starts to rise, are you going to know that at home?
No, good point. High blood pressure is like a silent killer. A lot of people do not know. You have no symptoms. And most times when people find out, they are already at risk of having complicated cardiovascular disease. Most people that have a stroke, heart attack, congestive heart failure, what we do know is that a lot of them have already had high blood pressure.
Wow. Yeah, because you know, with most things, you start to feel, I just don't feel right. And I didn't know if that was one of those where you're at home and something's not right, I don't know what it is, and it ends up being a blood pressure related injury.
It's a blood pressure related injury. Kidney failure, changes in your vision, all of those can come from uncontrolled high blood pressure. So there are a lot of things, but again, if you're inactive, you want to increase your physical activity, really do stress that. If you have other conditions such as diabetes, you want to control your diabetes with the help of your healthcare provider. So there are a lot of factors. Some things we can't change. We can't change our age. As you grow older, you get high blood pressure. If you are from African American or black descent, you may be predisposed, and you may have some family predisposition. But those things we can control, again, food, inactivity, you want to increase your activity, excess alcohol, and of course you want to stop smoking if you're smoking.
So I want to ask you this, and this may be a reach, but so I've started walking to get out and doing things, and I have I've got the little heart monitor thing. I always look at my app, and it'll show my heart rate as you go. Can I read anything into that to know whether or not that there's blood pressure problems there? Because I know my blood pressure's fine, but I didn't know if that was something that you can look at and think, whoa, my heartbeat is way crazy.
You know, when we get up to a really good pace, your heart rate may get up to about 120, and that's hypothetical. That may be good for you, that may be good for me. But everyone should exercise in a way that they can tolerate. But more activity than where you started at is good activity. But if you're exercising, you're short of breath, you become sweaty, which is diaphoresis, dizzy, you know, that's a sign that you need to talk to your provider, because maybe the oxygen that should be going through your blood, you know, through your body, there's a problem. So that's when you should get to your health provider. But 120 might be good for you and me.